if it's not a crisis, it's about as big a challenge as you could ever imagine. So I've never seen anything like it. I don't think any sector or country's seen anything like it. So it's a monumental challenge. What we have to do is not just sort of look and say, well, it's all too hard. We actually need to roll our sleeves up and get into it.
We are in a very interesting time when it comes to healthcare delivery. We have a young generation that looks at the work-life balance more than the current generation does. We also have an aging workforce. In Australia, for example, 30% of nurses are older than 55. So I think we are in a stage where there's going to be a transition where we're going to have to merge preferences of the new generation while taking into account the needs of the community. So it requires a very delicate balance, and I think it's going to be very interesting on how we find solutions.
There are so many elements about workforce supply that we could talk about. Retention on the other end is obviously a key issue. So there's, issues around culture that we could talk about in terms of what does the culture of our organisation look like? How do we support people to stay and be the best they can be in our environment? How do we deal with the younger generations in terms of what they want from their work-life balance?
There's quite a few kids who study sustainability degrees, whether it's in engineering or in health. And so there's quite a new workforce being grown, but we don't have enough jobs for them in the workplace yet. So this is something we have to create. And so, in a way, the universities were already a bit ahead of the game compared to the job market. And in a way, it's a great opportunity.
There are things that we have to do collectively as leadership. We have to be innovative. We have to look at new ways of attracting workforce. But to pretend it's not a challenge or a crisis is pretending that that's not reality.